All right, welcome everyone. Thank you for joining us today. I'll give a couple more seconds to see if I missed anyone in the waiting room, and then I will put up our slides to get started today. All right, welcome everyone to the December Master of Science in Addiction Policy and Practice information session. We're really excited to have you here as we get closer to our January 15th priority deadline, and we hope to see some of your applications coming in for that one or our regular deadline in April. So let's get started. So first, I'll go into a little bit about what to expect today. Firstly, we'll introduce ourselves and all our roles within the program. We have a special guest alum with us today that we're really excited to share with you all. We will talk about the program itself and why it was founded at Georgetown. We'll look into career opportunities and outcomes for alumni. I'll dive into an admissions overview and a review of financial aid opportunities at Georgetown. And finally, we'll leave plenty of time for questions of yours. So firstly, I'll go over kind of the core team of the program on the staff side. My name is Jennifer Jansen, or Jenny Jansen. I use she, her pronouns, and I am the program coordinator for the MS Addiction Policy and Practice program. What that means is I help support students from application to graduation through recruitment and admissions, academic advising, and other various needs. So I am a great resource for questions about the program overall and application logistics. From here, I will pass it off to Professor LaBelle, the director and founder of the program.
Hi, thanks for joining us this morning. I'm Regina LaBelle. I'm the, as Jenny said, professor in the program, as well as a director of the program, which started in 2021. My background is primarily in the public sector. I've spent several years in serving in the Obama and then most recently in the Biden administration. And prior to that, I served as legal counsel to the mayor of Seattle for his 2 terms. So my background is really public policy and the law, as well as drug and addiction policy. Thanks.
Great, let's pass it to Dr. Myers.
Hi, everyone. I'm Adam Myers, longtime medical science and School of Medicine educator at Georgetown University, doing research and developing various graduate programs. And a few years ago, I got involved in the launch of this program, and I've had a longstanding interest in issues around addiction. I've done a little bit of research on substances related to this field, and a lot of personal experience and family members, friends who have struggled with this disease. So I'm very happy to play a supportive role in this program. Some of the things that I do, I'm involved in the admissions process, some of the academic administration, and any of you who might be interested ultimately in further graduate education or specifically in areas of science related to addiction, I'd be happy to talk to you and give you further advice or my own viewpoint on pathways that you might pursue.
Great. Now we'll pass it to our guest today, Thaddeus, who is an alum of the program.
Hi, everyone. My name is Thaddeus Winston. I am currently the Overdose Survivor Outreach Program Coordinator at MedStar Georgetown University Hospital, as well as the team lead for our expert team here in the hospital. So we do all things substance use. Before I got into Georgetown's addiction policy, I was working here, and I had heard about the program from kind of outside entities and told, you might want to look into it. But I graduated from Georgetown in the 2024 cohort. I have my counselor certificate and now a master's in addiction policy from Georgetown. I still work here at MedStar, and I think we'll get into a little bit more about future careers in a little bit, and I'll talk about some of the avenues there with that.
Great. Thanks so much, Thaddeus. Since we have a few people on here today, we'd love to get to know you guys as well a little bit more. If you feel comfortable, feel free to use the raise hand function or type in the chat your name, where you're zooming in from, and what you're looking for in a master's program. Okay, we have one hand from Ray.
Hey everyone, my name is Ray. I use they, them pronouns. I am about to graduate from my bachelor's program at the University of Tennessee. I'm currently studying psychology and sociology, and I'm hoping with a master's program, really, with my career goals, I want to get into like community work and community justice. And that was something that really drew me to this program was that the health department with Georgetown takes a social justice approach to like community and public health. And so that was one of the things that really interested me here.
Great. Thanks so much for sharing, Ray. That's definitely one of the kind of core tenets of Georgetown education, coming from that sort of Jesuit social justice background. So we'd be happy to talk about that more in depth later. Catherine, I see your hand is up as well.
Hello. So yeah, my name's Catherine Williams. I go by Katie, and I use she, her pronouns. And yeah, I'm super excited about this program. I have my master's in social work, so this would be a second master's, and I'm actually licensed in clinical social work here in California. But I've done the last 10 years of my career doing clinical social work. I originally wanted to go into policy. That's why I pursued clinical, or that's why I pursued my master's degree in social work. But the easy track to get into with social work is normally they put you in clinical work. But 10 years later, over the course of my career, I've seen so many disparities, specifically with the addiction, substance use disorder population. And I worked specifically in a job where people on MAT, so medically assisted treatment, medication assisted treatment, there were just so many disparities and so many just things that I saw were, oh my gosh, just that policies could have helped so much and that where people were falling through the cracks. And I felt so helpless as a clinician, like I couldn't do anything. And so I was just looking up what types of programs there were, just kind of feeling helpless as a clinician and feeling like I need to go back to school. I need to do something. And literally this program popped up and I was like, wow, it's like it was designed for what I want to do. So super excited about the opportunity. And yeah, I would love to do something especially around making access to buprenorphine and that and MAT, especially in criminal justice settings, more accessible. So that's kind of where my interests lie. Because in California, that's something that even though the access is becoming more readily available, there's still a lot of issues because people are getting released at like 3 in the morning and their dealers are lining right up. And as we know, that's when ODs are happening. So yeah, there's some issues there.
Hey, thanks so much for sharing, Katie. We really appreciate it. I see in the chat, Alyssa has introduced herself. Her name is Alyssa. She's currently a nurse in Madison, Wisconsin, hoping to explore new avenues in the public health social work sector and see what opportunities there that her experience would align to. Great, excellent. Is there anyone else who would like to introduce themselves, talk a little bit about what they're looking for from the program?
Go ahead, Karen.
Hi. Yeah, I mean, I'm older and I've worked as a writer. I have a PhD in English. But for about 5 years, I kind of got sidelined, by my daughter's, addiction and I really learned so much, about how isolated families can get, about the need for community, both for, people suffering or struggling with addiction, but also for their parents and siblings. And my daughter's in recovery now. I see myself as being in recovery. I'm finishing a memoir about the experience, but I'd like to move more into an advocacy role and into writing that more directly involves advocacy. And I feel like I need to be so much better informed about policy and that perspective.
Great. Thank you so much for sharing. Right, excellent. All right. I think that's everyone who's on the call so far. But if you want to add anything later, feel free to let us know. But I'm sure as you already see from that, we have a lot of people who come from different backgrounds. We've had really excellent students who come straight from undergrad and students who are in career transitions coming back to school after a while. I think Thaddeus even wanted to expand on his intro a little bit there.
Yeah, I would like to add a little. So I'm a mid-career professional that came into this program, but I'm also a person with lived experience with substance use, and so I came in to recovery, working in residential rehabs, and then the hospital setting here. And I think that I heard a lot of that from all of y'all's introductions of, we all come from various kind of pathways here, and I do think that this program gives you the opportunity to, whether you're fresh out of undergrad or you're a working professional, to learn more. But the lights just went off in my room. Learn more about all the elements and angles with addiction policy, and learn what policy is. Learn how the connection between law and advocacy comes into play. It really did benefit me and in my career and just my general knowledge, how I do things here in the hospital and how I treat, what I do in my counseling job. So I just wanted to add that it is a great landing place. It sounds like you guys are in the right spot.
Yeah, thanks so much for that, Thaddeus. And thank you all of us everyone for sharing your stories. That's something we really appreciate, and we really love to get kind of to know more about the community surrounding our program and our efforts. All right, I will pass it to Professor LaBelle again to talk a little bit more about the faculty that also help us make up this program.
Great, thanks. So, the faculty members, everyone but myself, are adjunct professors. They all come from incredibly rich backgrounds on this issue. And I am so excited about, the team that we brought together. So first, Dr. Amanda Lattimore. She is founder and CEO of On the Shoulder of Giants Consulting. She previously worked for the city of Baltimore, as well as American Institutes for Research. She teaches in the fall social epidemiology and addiction. She's also affiliated with Johns Hopkins and their School of Public Health. Brandon Del Pozo is an assistant professor at Brown University. That is a relatively recent career shift for him. He previously was he's a researcher now, but he previously was the chief of police in Burlington, Vermont, as well as a police detective in New York City PD. He's also a veteran, and he teaches comparative approaches to addiction policy and is well regarded in the addiction policy field and has a lot of published articles. Dr. Wilson Compton is an addiction psychiatrist who's also the deputy director of the National Institute on, Drugs of Abuse at NIDA at NIH. He teaches Foundation of Addiction 1 and 2 in the fall and in the spring. He also is a prolific author of peer-reviewed journal articles and a great addition to our team. Next slide, please. Emily Einstein is now with the American Society of Addiction Medicine. She previously was with NIDA as well. She teaches neurobiology in the fall. And then Dr. Chris Jones is he's in the public health service currently positioned at SAMHSA. He teaches data and statistics of drug policy in both summers, summer 1 and summer 2. Talid El-Sabawi is a lawyer and PhD. She teaches U.S. addiction policy, which is kind of a survey class that you take in the first summer. She is an associate professor at Wayne State and also is affiliated with us at the O'Neill Institute, where we co-author a lot of pieces. Next slide, please. Finally, our final two professors, Shelley Weissman is also works with me at the O'Neill Institute, where we do a variety of topics, including adequate treatment for people who are incarcerated and upon leaving incarceration. In the spring, she teaches mental health law and addiction policy. And then finally, Beth Connolly is with Winning Strategies Washington. She previously worked at the White House Office of National Drug Control Policy and also was the director of the Office of Behavioral Health in the Christie administration. She also right now is on the transition team for the new governor, the incoming governor of New Jersey. She teaches healthcare financing in the first summer. Next slide, please. So the reason we started this program in 2021, I had, as I said, I served in the Obama administration, and many times I found that the addiction policies, the drug policies we were putting forward were based on really rooted in stigma and misperceptions as opposed to science and evidence or even compassion. And so we were fortunate. I was still at the O'Neill Institute, already at the O'Neill Institute, and I was fortunate to find people at Georgetown who felt as strongly as I did about it. And we built this program. It wasn't a hard sell to people to ask people to teach these classes on top of their regular work, because it's so strongly felt that unless we have addiction policies that are driven by science and evidence, we'll continue down this trajectory that we've been on for a long time. So the first cohort started in 2021, and we'll talk about employment opportunities in a bit. But really the whole point of this is that we have people who are entering jobs who don't need on-the-job training, that they understand the issues that are facing the nation, and also don't just understand what needs to be done, but understand how it should be done. How do you get legislation passed? Is it a rule? Is it a regulation? What are those policy levers? Those are the kinds of things that we cover all the time in this program. Next slide, please. So I'll give you the program overview. Next slide, please. So we were very intentional about making this a one-year program, 30 credits, 1 year. It starts in July and runs through the following June. There are full and part-time options. Right now, we have 4 part-time students. And it is really a unique program. I have seen there's one, there's Master's of Public Health with a concentration of behavioral health. There's one other program that's a research master's, but really this program is the only one where you're going to learn the science as well as the political science of getting things done. There is a reduced rate for tuition for this program, and we'll talk in a little bit about financial aid. This is not the rate, as it says here, the rate's pending for next year, but we do have a reduced rate of 30% because of the university's commitment to this program. So this is the full-time schedule. Summer 1 is virtual because we don't expect you to get admitted in April and then move to DC right away. So you'll learn these are the building blocks: healthcare financing, U.S. addiction policy, data analysis and statistics. That prepares you for the fall when in August, when we start with the fundamentals of neurobiology, the impact of substances on the brain. I teach the integrative seminar. It's a year-long, it goes fall semester and spring semester, and this is where we combine the science that you're learning with the policy making. And it's very interactive. Students have an opportunity to learn to lead discussions, and we have guest speakers because this addiction policy field is very committed to this program. And we're in DC, so we have a lot of opportunity to hear from people in person in DC. I also have people from out of state who will speak sometimes to the students about their work in the field. Dr. Compton teaches Addiction Psychiatry 1, and then Dr. Lattimore, Social Epidemiology. In the spring, Shelley Weissman teaches Addiction and Mental Health Law and Policy. We have the second piece, the integrative seminar. In that integrative seminar, what we actually have students do in the spring is we ask you to go to a program like Thaddeus's, which we can talk about, and come back and report back about that program, how policies might impact it, what could be done to make it better. And then Foundation of Addiction Psychiatry 2, and then you have a policy elective. There's a number of classes that you can take across the Georgetown campus that will really, it's only 2 or 3 credits, but I think, and we'll ask Thaddeus in a second to share what policy elective he took. But it's a great learning experience. And then finally, summer 2 is in person. You have comparative approaches. So what does Portugal do? What are other countries doing about addiction policy? And then the second half of data analysis and statistics. And finally, your mentored capstone. This is an opportunity for you to take everything you've learned and you're most passionate about and put it into not just a paper, but also a policy piece. So it can be you apply to speak at a conference. It can be a poster session. It can be an op-ed that you've written. So that's kind of the overview. And I think it'd be great at this time of the full-time option for Thaddeus to kind of share a little bit more about a few pieces of this.
Yeah, so I think to start off with, all of the professors brought some just amazing content to the program. I think one real standout for me was the neurobiology of addiction course that when I first interviewed with Professor LaBelle, being a mid-career professional, having lived experience and 10, 15 years of my life that was in active addiction, she looked at my college transcript from 2001. I'm a walking, talking, person from the opioid epidemic, and she looked at the transcript and she said, "You have no science here. You have nothing," and it almost hindered me from getting in the program. I'm so glad she took a flyer on me and took the risk and got me in, because I learned so much in the neurobiology of addiction. It was a breakdown that I apply and use every single day here in the hospital as we approach, substance use disorder from a healthcare perspective. Dr. Lattimore, with her social determinants of health, in our seminar course, we had amazing spirited debates on topical discussions, and things would happen in the news, and we would break it down and digest it and discuss it as a class. And that kind of goes through the whole program. Professor Compton is a breakdown of all the various substances in kind of week-to-week chunks, and you really do a deep dive into marijuana and opiates and all of the things, and MAT. It was just very, very comprehensive. All of the professors bring wonderful experience and titans of industry, if you want to call it that. As far as my elective, I took an Easter break elective, which is a 1-week intensive course, and I thought I would lighten my load. I took organizational change management. There are plenty of other electives. My elective experience, it wasn't a bad experience, but it was incredibly intensive when everybody else was on break. So that was and I'm happy to, if you guys get into this program, help with some guidance and some suggestion on, what you might want to do or other courses you might want to take, or you might want to take that course to lighten the load. Like I said, I'm a mid-career professional, and I was working full-time through this program. And a lot of my other cohort members were, out of undergrad, doing maybe a light internship, and it definitely affected my approach to everything. And so knowing all that and working full-time, I took the Easter elective. It was still, I know that there are a lot of other electives to take. It wasn't a bad experience, but it was very intense, and it was, a college course in 1 week. So take with that what you will. The summer sessions are mostly virtual. So the first summer session is fully virtual, and then the second one, you have a little more virtual ability, which is nice, and it kind of lightens things a little bit. But I will say to all of you considering this, that you get through the year, you go to graduation, and then the summer session starts. And for all intents and purposes, with your capstone due, that is the most intense portion. So it's just a fair warning that that's really when you need to hit overdrive and double down. You get this graduation, and then it's like, oh my God, now the real work, now the big kind of crescendo happens. So just fair warning with that. Did I cover everything, Professor LaBelle?
Yep, sounds good. Thanks. So we'll talk about the sample part-time schedule, which is right here. So, you take basically 2 courses over an extended period of time. My class and Professor Weissman's class are during the day, but most of the others, except I think comparative approaches to addiction policy, are towards the evening. So for part-time students, I think it's doable for you to work and complete the program. And so the curriculum is the same, it's just basically extended over a longer period of time. So far, we've had 2 students who have graduated from the part-time program. And if anyone's interested in that, we can certainly have you speak with them. Next slide, please. So, the addiction policy field, as I mentioned, is pretty committed to the success of the students in this program, because, what we want to do is not just have like, oh, we've got the opioid crisis and we're going to address it for 10 years and then we'll go back to business as usual. It's not just about opioids. This is about the range of conditions, including gambling disorder. We do cover that in our classes as well. So our students work in a number of places, and from nonprofits to state government, and a few have worked in the federal government. Right now, the federal government is a trickier place. We've had students who have been laid off from the federal government. And so we encourage students to look at state and local governments, as well as the number of organizations. So this is a picture of Ben Freifeld, who was in our first cohort. He works with the Maryland, in the state of Maryland, and on their opioid litigation funding program. And here he's training the governor and the lieutenant governor on opioid, on naloxone distribution. So as you can see on the left side, we've had students who worked at ASAM, American Society of Addiction Medicine, American Medical Association, and any number of different organizations. And we also have, this is a nonpartisan organization. We've had at least one of our students work on the Trump when he was an alumnus, on the Trump transition team. And we've had a few folks who were political appointees in the Office of National Drug Control Policy during the Biden administration. In addition, as Dr. Myers said, we've had students who are interested in coming to the program to prepare them for future education. We've had 2 students who are currently in med school, and we have a few students who are currently in law school. So, there's a number of career opportunities, and we also, in the fall, match our students with mentors. And these are the career mentors. Again, we're committed to the success of the people in this program, because it's not just a year and you're done. You're with us. You're with us for the long haul. We're with you for the long haul. And, we really work to build those connective tissues, both in DC and in other parts of the country. So if you have, you want to go back, like we had a student from Oregon and Washington State, we connected them with career mentors in those states. Thaddeus, you want to talk about your career mentorship experience?
Absolutely. So I was matched up with Tom Hill, who had a background in at SAMHSA for 20 years, Substance Abuse and Mental Health Services of America. But before that, Tom Hill was an early harm reduction advocate, and he was in New York City in the 80s with a group called ACT UP, which was the early HIV syringe service distribution program when it was super underground. And being that I work in harm reduction here in the hospital and I have a penchant for it, I couldn't have asked for a better mentor, a kinder person. But at the same time, like we met, and I got to kind of just absorb a lot of his experience through our conversation, as well as work towards my capstone, and use him as a soundboard to build out an idea, to say I'm working on X, Y, and Z, and have him help me craft it and turn it into what ended up being my capstone thesis, which was, the fact that a program like this has a mentor that kind of fits where you align and where you kind of want to go, where your passions lie. And then as long as you work with that person, you develop your own relationship. I think it's just one of the greatest things about this program to have, outside professionals that have years of experience that can help you kind of hone your craft as you're going through this program. So nothing but great things to say about it.
Thanks, Thaddeus. So our students get very involved in local community issues, and we also have, we're seeking to build a recovery-ready campus at Georgetown, and our students have taken that first step by developing, and Thaddeus was instrumental in this, the Hoyas for Recovery program at Georgetown. They have a dedicated space now and do various events. So let me just walk you through briefly about what these events are, just the pictures here. Earlier this year, we had the 2025 Mobilized Recovery Campus Surge on campus. We had a really great event where we had a panel of students who are the founders and current members of Hoyas for Recovery. Our students have taken part in Walks for Recovery, have distributed naloxone. We have a small fund that helps pay for people to go to various events, including the RX Summit, which is held annually in Tennessee this year, has been in Georgia in the past. And then finally, Hoyas for Recovery does a number of different events, which I'll turn it over to Thaddeus in a minute, including Georgetown Day on campus, like many universities have. A day right before finals it's pretty, it can be off-putting for people in recovery. You don't feel included, but it also is a day when you want to make sure you're sending out the message about different ways to celebrate the end of classes. So students at Hoyas for Recovery held an event a few years ago, and every Hoya Day they do, Georgetown Day. Thaddeus, you want to talk about that?
Sure. Yeah. So, I think that one of the key components with Hoyas for Recovery is you don't have to be in recovery to join us, to go to the events, to come to our meetings, to go to the baseball games and hockey games that we do, every year. And I think that Georgetown Day being the biggest party day, the biggest open party day of the year on a campus that we don't have that much partying here. It gives us an opportunity to be out amongst, the undergrad community and say, this is what harm reduction is. This is, we give out fentanyl test strips and naloxone. And we talk to people about, if it ever becomes a problem, we meet in the Copley basement on Tuesdays and Thursdays. And if you are just curious, if you want to be an advocate for people in recovery, it is a group that is kind of dedicated to all of that. We have, your typical AA style meetings on, I believe it's Tuesday nights now. And then we have a non-denominational, just a general harm reduction, SMART oriented Thursday night meeting as well. We're kind of branching out with that. I was the president of Hoyas for Recovery in my cohort. In the cohort after ours, we had co-presidents. And again, this year we have co-presidents that span one of them is a part-time student as well. Being that this program is only a 1-year program, it can be very intense and very quick. But I do encourage all of you, even if you're not in recovery, to kind of join, go to these meetings, meet some of the alumni and other students on campus, have the discussions that kind of are involved around all things recovery, all things harm reduction, and come out to the events with us. I think it really is one of the core tenets of recovery is community building, and being able to have that here on campus. A collegiate recovery program is huge. It's not something that Georgetown had. It's not something that most colleges have. So, setting that foundation and getting people involved as the program turns over year to year is a key goal here. It will give you, wonderful experiences and access to some of the current and former people, students here.
Right. Thanks so much for sharing, Thaddeus. I also do want to flag there that ADPP students are the ones who are eligible to become presidents and co-presidents of the organization. So that's definitely another great way to get involved on campus when you enroll in the program. Now I will turn it over to admissions overview and talk a bit about what to expect when applying to the program, as well as financial aid opportunities at Georgetown and beyond. Firstly, here is an application checklist. Feel free to screenshot this if that's helpful for you, but also all of this information should be on our program website. First of all, you'll need to complete your application form online, which is at gradapply.georgetown.edu. Secondly, you'll need to submit an application fee. However, this is a great time to be thinking about the program because that fee is actually waived if you submit your application by January 15th, 2026. You will then need a approximately 500-word academic statement of purpose in which you can discuss your academic journey, professional journey, what brought you to apply to the program, and what you hope to get out of it. Although it's listed as optional, we do really strongly urge you to fill out the personal background statement, which is approximately the same amount of words in the portal. This is a really great way to expand on your personal background and experiences and how they contribute to your interest in the field. And it's also a great way to demonstrate that you'll be an active contributor in our community, which, as I hope you saw throughout this presentation, is something that is really, really important to us. Next up, we require your resume or curriculum vitae and 2 letters of recommendation. If you are early in your education, say you've recently completed or are currently completing your undergraduate degree, we would love to have at least 1 recommendation from an academic you've worked with, such as a professor. But again, as you've seen, we do have a number of applicants who are long out of school. So we will accept 1 or both letters from a trusted professional, such as someone you've worked with. Another good thing to know here is we require names and emails of recommenders by the deadline, but you do not need to have their letters in hand to submit. If one of your recommenders hasn't submitted their letter by January 15th, as long as you have your name and email, you're good to submit that application and it will not be considered late. They'll have a grace period of a couple weeks to upload their letter on your behalf. And you can even check the status of their letters and send them reminders through the application portal. Next up, as soon as it's available, we will need transcripts that confirm you have completed your undergraduate study, if this is something you're currently working on. We will accept unofficial transcripts by both the priority and the regular deadline, but we will, it should be noted, need the official ones submitted before the start of summer classes if you're selected for admission, just to confirm that you are eligible to continue on to graduate study. Finally, if you attended a school where English was not the primary language of instruction, you should submit a demonstration of English language proficiency. This can be indicated, as you can see in those bottom two blue boxes, via the TOEFL or IELTS score. You'll see the minimum scores we require from both of those tests to be considered eligible for admission to our program. And you'll also see above that, we do not require the GRE test. So what does it take to be considered eligible for the program? Firstly, applicants must hold a bachelor's degree or equivalent from an accredited institution. This should be equivalent to a four-year undergraduate degree in the United States. If you are an international student who is not sure about their degree, you can submit a credential evaluation, such as the WES evaluation, in order to confirm that for our admissions team. Next up, as you can see, we are really passionate about what we do here, and we love to see that in our students. We want to see people who are ready to become policy change makers now. So demonstrated interest in addiction policy is a really great thing that we love to see. Interest in public policy, social science, healthcare, or community service, all of that is strongly preferred, and consideration will also be given, of course, to individuals with lived experience. Finally, we do require a minimum grade point average of 3.0 on a 4.0 scale. This is required by Georgetown University, the Office of Graduate Studies in particular. However, I do want to draw your attention, with all this being said, to that blue box in the corner, because we conduct a holistic review of applications. What that means is we acknowledge that we've had really successful students come from a variety of different backgrounds, and some of them are even currently in long-term recovery. We know that not everyone has the same professional or academic journey, and we really want to honor that when reviewing your application. So if you are concerned about any of these eligibility requirements, we do really encourage you to reach out to us via our email, addictionpolicy@georgetown.edu, or to me directly, because in some cases we've been able to make successful appeals for admission if someone does not meet some of this criteria and is otherwise a compelling candidate for admission. Here are those deadlines I mentioned at the beginning. The priority deadline is January 15th of 2026, and it is free to apply until this period. The regular deadline is April 1st. We will review applications on a rolling basis from January 16th to April 1st. The application fee after the priority deadline is $90, and classes will begin for everyone at the same time. The next cohort will begin in July of 2026. So finally, I'll touch upon financial aid a little bit. As we mentioned, the 2026 tuition rate is not confirmed yet by Georgetown. However, it will likely be a 4% increase to last year's rate of $17.47 per credit if you want to do some kind of initial calculations. The majority of our students have financed their degrees through multiple sources, such as if they were working while in the program, employer tuition benefits, fellowships, and other sources. We recommend searching for external fellowships and scholarships early, due to the fact that we have already negotiated a discounted tuition rate for all applicants. We are unable to offer additional internal scholarships from our program. However, there are some resources across Georgetown to help you look for external scholarships. There are services like ProFellow and Scholarships 360, as well as the Office of Graduate Studies webpage, which has a specific page for fellowship and scholarship advice, places people have applied before, and things like that. The Office of Student Financial Aid also has more information on deadlines and tips for applying to external scholarships. If you are eligible for Veterans Affairs benefits, make sure to contact the GU Veteran Service for more information on starting their application process. We also encourage domestic applicants to submit the free application for Federal Student Aid, or FAFSA. Grad students are indeed eligible, and they can be found eligible for federal low-interest student loans or even federal work-study status. The Graduate Career Center also offers a number of resources to find and apply to external scholarships, and fellowships, as well as, of course, ongoing support for matriculated students applying to jobs. But as for jobs on campus, as soon as you're enrolled in the program, which means you're admitted and you submit an enrollment deposit, you are able to apply for on-campus jobs through the GMS or Workday portal at Georgetown. Graduate positions are typically above the DC minimum wage of $17.95, so that's a good thing to know, and it can give you experience in different areas across the university as well. Students can work for up to 20 hours a week at Georgetown while studying there, and some positions, such as research assistant positions, teaching assistant positions, are offered at a higher hourly rate, approximately $23, $24, because they are subject to a collective bargaining agreement with the university. It should be noted, however, that these RA and TA positions do not come with housing or tuition benefits. Finally, the Georgetown Office of Revenue and Receivables offers monthly installment payment plans for tuition through their office. You can sign up through the billing portal for Georgetown when you receive your first tuition bill. All right. Thank you all so much for staying and listening to a lot of information. We know you're just as excited about this program as we are, and we'd love to pass it over to you now to get to know a little bit about what you're interested in and what you want to learn more about the program. So if you have a question, feel free to type in the chat or use the raise hand function on Zoom, and we'll get that started. Great, thanks for joining us, Katie. Right, we have a question from Ray. Go ahead.
So I just want to make sure that I'm understanding, like completely clear about the January 15th deadline. So if I hit submit on my application, but one of my recommenders isn't quite in, is that application fee still waived within that grace period for submitting the letters of recommendation, all that information?
Yes, that's a great question. Absolutely. If you've submitted recommenders' names and emails and your unofficial transcripts by that deadline, you will not be charged a application fee later. We know it'll take longer for the recommenders to get their letters in, and that's perfectly fine. Great. Do we have any other questions about the program, about applications, general?
I wanted to add, if anyone is local, or even if you're not local and you want to attend the class, just let Jenny know. My class is every Friday at 2, starts at 2, and you can either come in person or by video, by Zoom, or any of the other classes. The professors often have people sit in or participate via Zoom. We just need to know in advance.
Yeah, absolutely. We're always happy to have people sit down in classes and see what it would be like to be a student.
I'd add the same thing. Honestly, if they wanted to reach out, I could tell them about my experience in the program if anybody ever wanted to hear it. And then here at the hospital, if you are local and you want a glimpse into what work is done in the healthcare setting, I'm always thrilled to let people, see behind the curtain a little bit here.
Great, excellent. Ray also asked how many members we're looking to add to the new cohort. Typically, our cohorts are an average of 13 to 15 students. Currently, we have 13 new students. 2 of them will continue part-time next year. And we have 2 additional students who are part-time with that cohort, which brings us to 15. And they'll be graduating this August with everyone else. Great. I'll put up our contact card in case there are any other questions after this. You're more than welcome to reach out to us via our program email, which is addictionpolicy@georgetown.edu, or our program phone, 202-687-6575. We'd really love to get to know you more. So whether you want to be matched with a student or an alumni, or you'd like to reach out to Thaddeus directly from this call, or of course you want to take a look at campus, meet us in person, go to a class virtually or in person, all of that we're happy to set up via email or phone. So feel free to call us. I also recommend following our social media. Our students are very active, as well as our alumni. People are always publishing, going to events, doing really great achievements, and we really love to celebrate that. So following our Instagram and our LinkedIn page is a great way to see in real time what our students have been up to, both while they're in the program and after they've graduated. From there, we wish you a great rest of your afternoon, and thank you so much for joining us today. We really look forward to your applications, and we wish you a happy holiday season.
Thank you.
Thanks, everyone.
Bye-bye.